Hello everyone, today we're going to share a case of motor neuron disease. Motor neuron disease, commonly known as amyotrophic lateral sclerosis, ALS, or gradual freezing disease, is a rare condition. It gained fame partly because Stephen Hawking was diagnosed with it. The Ice Bucket Challenge, participated in by many celebrities in the past couple of years, was also a fundraising effort for this disease. Motor neuron disease is a neurodegenerative disease, with an average survival time of about 3 years. Let's look at our case for today. This is a female patient, over 50 years old, diagnosed with motor neuron disease. 6 months ago, she started experiencing weakness in her right hand, with muscle atrophy beginning in her right thumb. The condition progressed rapidly, her right hand strength declined, and she couldn't grip a pen. Her left upper limb also showed muscle atrophy, and she experienced varying degrees of muscle pain throughout her body, particularly in her right hand, along with muscle trembling. Her speech became unclear, her voice hoarse, and she choked when drinking water. Her complexion was dull and lifeless. She experienced back pain, cold hands and feet, numbness in the soles of her feet, drooling, poor appetite, disrupted sleep, normal urination, and unformed stools. Her tongue was thin with an uneven surface, dark in color, with a thin, white, greasy coating, and her pulse was deep. Let's analyze this condition in detail. Overall, the patient shows signs of deficiency, evident from her dull complexion and lack of vitality, indicating qi and blood deficiency, unable to nourish the face. This is a part of inspection diagnosis in traditional Chinese medicine, TCM. Inspection diagnosis isn't complex. For instance, someone might say another looks unwell, possibly due to staying up late, which is also a form of inspection diagnosis. Her upper limb and tongue muscle atrophy are indicative of spleen deficiency. In TCM, the spleen governs muscles and limbs. Spleen deficiency hinders the transformation and transportation of nutrients, leading to insufficient qi and blood and thereby failing to nourish the muscles. Additionally, spleen deficiency results in the body's inability to transform dampness, turning into phlegm, which is sticky and obstructs the flow of qi and blood, eventually causing muscle atrophy. As mentioned, her dull complexion indicates blood deficiency. According to TCM, blood is generated by the spleen. The Yellow Emperor's Classic of Medicine says, the middle burner receives qi and extracts juice, which transforms into blood. Therefore, a dull complexion is also a manifestation of spleen deficiency. Her unclear speech, hoarseness, and choking are symptoms of the disease affecting the medulla and impacting her throat. In TCM, the throat is considered a pathway for stomach qi. The stomach and spleen are interrelated organs, hence the saying the throat is an indicator of the spleen and stomach. Thus, these symptoms also indicate spleen deficiency. Drooling is also a sign of spleen deficiency. In our body, there are 5 types of fluids: tears, sweat, saliva, nasal mucus, and spit, corresponding to the liver, heart, spleen, lungs, and kidneys, respectively. Saliva, particularly its thinner component, is governed by the spleen, and spleen deficiency leads to drooling. People who drool in their sleep might also have spleen deficiency. Poor appetite and lack of it are typical of spleen deficiency, unable to receive and assimilate food. Disturbed sleep is related to spleen deficiency, as the spleen fails to nourish the heart. Unformed stools indicate the spleen's inability to transform and transport nutrients. This kind of loose stool, however, is different from diarrhea with a strong foul odor. A thin, white, greasy tongue coating is indicative of spleen deficiency with dampness and phlegm, as we have discussed in some previous case analyses. A deep pulse is a sign of deficiency. Apart from spleen deficiency, the patient shows other symptoms. One is back pain, typical of kidney deficiency. Also, unformed stools are related to kidney deficiency. We mentioned earlier that unformed stools are related to spleen deficiency, so how are they also connected to kidney deficiency? In fact, stools can reflect problems with all 5 organs. Her kidney deficiency, with insufficient yang qi, can be likened to a furnace with a low flame, unable to properly cook what's above it, resulting in loose stools. Her cold hands and feet indicate kidney yang deficiency. As people age, their kidney qi naturally diminishes. Additionally, the kidneys represent the congenital foundation, while the spleen represents the acquired foundation. There is an interdependent nurturing relationship between the congenital and acquired. Spleen deficiency leads to insufficient nurturing of the congenital kidney qi, resulting in kidney deficiency. We also note the patient's muscle tremors, which relate to a unique concept in TCM, internal wind. It's known that the kidneys store essence and the liver stores blood, and there's an interdependent relationship between essence and blood, hence the saying the liver and kidneys have the same origin. Following kidney deficiency, the essence in the kidneys cannot generate liver blood, leading to both liver and kidney deficiencies and insufficient liver blood. Furthermore, the liver stores blood, while the spleen generates blood. But now, with spleen deficiency, blood and qi cannot be generated, resulting in insufficient nourishment to the sinews and causing muscle tremors, a manifestation of liver wind. What other symptoms does the patient have? Muscle pain, numbness in the soles of the feet, and a dark tongue color. What is the cause of these symptoms? The saying, "Where there is obstruction, there is pain," indicates blood stasis. Why does blood stasis occur? One reason is the deficiency of the liver, spleen, and kidneys, leading to insufficient blood production and dryness in the blood vessels, causing poor blood circulation and stasis. Another reason is the general weakness of the organs and insufficient vital energy. Normally, qi helps to propel the blood, but now the deficiency of qi fails to drive blood circulation, resulting in blood stasis. Additionally, as we mentioned earlier, spleen deficiency leads to the production of phlegm, an invisible type of phlegm different from the visible phlegm we expel when coughing. This invisible phlegm obstructs the blood vessels, leading to poor blood circulation and subsequently, blood stasis. Thus, there are multiple causes for blood stasis. Now we have a basic understanding. The patient primarily suffers from spleen deficiency, which leads to liver and kidney deficiencies. Kidney deficiency further aggravates liver deficiency, and the combined deficiency of liver, spleen, and kidneys leads to blood stasis. This is the progression of the condition. Therefore, the patient's condition involves a complex interplay of organs. We are almost ready to begin treatment, right? However, let's consider this. Many diseases or people have spleen deficiency, or spleen deficiency leading to liver and kidney deficiencies. We know that this type of deficiency is a chronic process, but the muscle atrophy and other clinical manifestations of motor neuron disease progress very rapidly and severely. Why does this happen? This suggests that, in addition to the deficiencies in the liver, spleen, and kidneys, there is also an accelerating mechanism in the patient's condition. This is referred to as toxic evil in traditional Chinese medicine, TCM. Toxic evil is a complex term in TCM. According to the ancient Chinese dictionary Shuoanjiezi, poison is a harmful herb, described as poison, thick, a herb that harms people. However, harm is not limited to herbs, it can be understood as harm from external sources. For example, the cause of motor neuron disease is unclear, but certain environmental factors, such as heavy metal poisoning, may be related to its occurrence. Additionally, TCM states in ancient medical sayings, an excess of evil is called poison. This implies that poison has some internal factors for its production. However, whether from internal or external sources, toxic evil can accelerate the damage to organs and imbalance of yin and yang, leading to rapid progression and worsening of the disease. Therefore, for this patient, toxic evil damage acts as an accelerator in the progression of the disease. Therefore, in treatment, strengthening the spleen and nourishing the kidneys, as well as invigorating the liver and promoting blood circulation, are essential steps. At the same time, detoxifying medications must also be used in treatment. Otherwise, it's like having both the inflow and outflow pipes open, and the pool can never be filled. However, detoxifying medications often have side effects that can harm the righteous qi, so it's essential to consider the overall balance of the prescription when using them. The patient mainly suffers from spleen deficiency with toxic damage, along with liver and kidney deficiencies, and blood stasis. I used my own modified version of the Buyuan Jiadu Tang, mainly using Chinese herbs like Scutellaria bicalensis, Chinese skullcap, and dandelion for detoxification. Motor neuron disease itself is a neurodegenerative disease, and its condition is difficult to reverse. Although treatment requires continuous adjustment of the prescription according to the disease progression, the overall direction remains unchanged. After treatment, her symptoms improved, her spirits lifted, and there was a noticeable improvement in eating and sleeping, and the muscle twitching stopped. Her overall quality of life significantly improved. This can be considered as achieving the treatment goal of delaying disease progression and alleviating symptoms. Alright, that's all for today's share. Goodbye.